Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D Wilson.
This is Pamela D. Wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey to let you know that you are not alone. You're in exactly the right place to share stories, learn about caregiving programs, and resources to help you and your loved ones plan for what's ahead. Invite your aging parents, spouses, family, and friends to listen to the program. If you have a question or an idea for a future show, share your idea with me by responding to my social media posts on Facebook, Instagram, Twitter, YouTube, and LinkedIn. Today, the topic is women as caregivers. Fair warning, this topic may have you feeling a little uncomfortable because I will be posing questions that have an impact on your career, the ability to be financially independent, and family life. These are all topics that should be considered in the broad term of life and family planning. I will share a lot of statistics for those of you interested in research and numbers. There'll be links to all of the articles in the show transcript, so be prepared to hear some numbers and statistics about women as caregivers. As many of you know, I speak to female and male caregivers in my caregiver support groups and my consultations. Women, by far, feel more stressed and financially constrained than men. So today we'll be talking about women as caregivers and looking at the question of how family caregiving responsibilities financially affect the ability of women to be self-sufficient. To elaborate on the topic of needing care for women who never marry or have children, Dr. Katherine Ornstein will be sharing her research article, A National Profile of Kinlessness at the End of Life Among Older Adults. You can read this article and all the articles that I'll mention if you navigate to the Caring Generation podcast page on my website, PamelaDWilson.com. Go to the top bar, look for the word media, then scroll down to the Caring Generation podcast and look for episode 131. A little about Dr. Ornstein. Katherine Ornstein is an associate professor in the Department of Geriatrics and Palliative Medicine and the Institute for Translational Epidemiology at the Icahn School of Medicine at Mount Sinai. She is the research director for the Institute for Care Innovations at Home at Mount Sinai. Dr. Ornstein is currently leading several NIH and CDC-funded research projects on caregiving. She received her BA cum laude from Duke University, her MPH from UNC Chapel Hill, and a PhD in epidemiology from Columbia University. Dr. Ornstein has 2 children and is a caregiver for her father who lives in New York City. She's also a returning guest to the program. If you'd like to listen to our prior conversation, search for the Caring Generation podcast episode 58, called How to Get Elderly Parents to Accept Help. So let's set the stage for the discussion of women as caregivers. I am pro-women in all aspects of life, while at the same time I understand the contributions of men. Life is a different journey for everyone with different expectations based on where you live, family life, culture, education, income, and interest. Generally, though, we know that men are expected to work hard to support their families. Women are expected to be family caregivers by virtue of their ability to have children and a past history of women caring for aging parents and other family members. Throughout the program, I'll share facts about women in caregiving from a study that I recommend called Women in Caregiving Facts and Figures. I'll also share information from another article called What Comes After Caregiving? The Impact of Family Care on Women's Employment by Ulrike Ehrlich. Both are great sources of information for women and families who want to consider the potential effect of caregiving on their lives. Caregiving for this show is all-inclusive. It doesn't matter whether caregiving means having children, caring for elderly parents, spouses, or other loved ones. So let's begin with some statistics from the Women and Caregiving Facts and Figures reports. Women who are family caregivers are 2.5 times more likely than non-caregivers to live in poverty and 5 times more likely to receive supplemental security income. Is this shocking? Is this what you expected to hear about women as caregivers? 2.5 times more likely than non-caregivers to live in poverty and 5 times more likely to receive supplemental security income. Personally, I think it's shocking and very sad that women who care for other people all of their lives are more likely to live in poverty as the result of giving up the ability to earn and save income for their retirement years. While there may be this belief that the government takes care of old people through Social Security and Medicare, this isn't always true to the degree that you might think. This is a conversation that may have you thinking more seriously about the effects of being a family caregiver and the importance of remaining in the workforce, remaining employed. Let's start with the definition of SSI, which is very different from Social Security retirement income. SSI means supplemental security income. If you want more specifics, navigate to this podcast episode 131 on my website. There'll be a download for the Social Security SSI Annual Statistical Report for 2020. SSI is an income payment from the government for disabled, blind, mentally ill, and other adults who are unable to work or who are limited in the time that they can work. However, if you do work, you can still collect SSI benefits, but they're reduced. I know this can be complicated. That's why it's important to read many of the brochures and the documents that I'm referencing in this podcast. Now, you might be thinking, woo-hoo, money from the government for being unable to work. Well, don't get too excited. First, you have to qualify. And second, the average monthly payment according to Social Security in December 2020 was $576 per month, so not a lot of money. Here are a few other statistics about SSI. The majority of SSI recipients in 2020 were female at 52%. 14% were under age 18. 57% were age 18 to 64, and 29% 65 or older. 6 out of 10 recipients under age 65 were diagnosed with a mental disorder. 57% of SSI recipients had no income other than their SSI payment, and 33% also received Social Security benefits, which means they were retired. In the most part. There are reasons that you can get Social Security income other than being retired, but for this show, we're not going to go into that. So why is any of this important? Health issues can result in anyone of any age being disabled or unable to work, or if you were working, to perform a similar job. So then you can receive income from the government, but at a very low amount, like we talked. Some family caregivers have an interest in becoming a paid caregiver for elderly parents. There are some state Medicaid programs that offer this. For example, a page on the state of Illinois website, link will be in this transcript, says, if the work these family caregivers had to be replaced by paid home care staff, the estimated cost would be $45 to $94 billion per year. 85% of all long-term care services are provided by unpaid caregivers, which means family caregivers. Why is this important? Paying family members to be caregivers is actually an incentive for the government to spend less on the Medicaid program. But is this program really in the long-term interest of family caregivers? Because the money saved by the government means that family members are keeping loved ones at home instead of accessing Medicaid in an assisted living community or in a nursing home, which truly is not a place where people want to go, but it's flipping the income payments. And what I'd like to see on this is a comparison of the work and career trade-off for family caregivers, who then end up in poverty in retirement and need government assistance themselves. So in a sense, are we giving government assistance to save some money here and then spending more government assistance later? Is the amount paid out less than the amount family caregivers save the government? I'm not sure anyone here in the United States calculates this. So I'll give an example of this program in Colorado. It's called C-Dash, Cash and Counseling. Family caregivers here are paid around the minimum wage rate. However, parents must qualify for the program for Medicaid. The benefit, obviously, is peace of mind for some families who want care for their loved ones at home. But as in any care situation, there are trade-offs. Interestingly enough, European countries are beginning to study the effects of these programs. The research article linked to this podcast transcript investigates the likelihood of women to re-enter the workforce or to increase working hours after becoming a family caregiver. So according to the report, 12 European countries confirm that women do not increase hours worked, and many who are unemployed do not re-enter the workforce due to a lack of skills that make them employable again. Additionally, it talks about women's post-caregiving employment being determined by their health, for which many caregivers, as we know, is worse after caregiving than before becoming a caregiver, because the mental stress and the physical stress is extreme for caregivers. So all of these statistics can paint a really bleak picture for women who may spend the majority of their lives in caregiving roles and a great deal of that time not working. So rather than continuing to dwell on all of these numbers that are very important to know, what is the bright spot for women and for all caregivers, for men? The bright spot is knowledge, learning all you can about the financial effects of caregiving so that you can decide, rather than having a life or family situation make the choice for you. Education for everyone is power. Being the person with facts and research who can initiate these discussions in your family can make a difference. To add a practical point of comparison, would you buy a car without listing out the associated costs? For example, the purchase price of the car, the sales tax, your car insurance, gas, oil changes, and maintenance. So according to AAA, the American Automobile Association, the average cost of owning a new vehicle in 2020-2021, $9,292 a year. Now that includes depreciation and interest on car loans. Buying a car is a financial decision. Buying a home is a financial decision. Becoming a caregiver is a financial decision. I know that most families don't like to relate caring for aging parents as a financial decision or as a cost, but in the end, it really is. It's no different than the decision to have children and the cost and impact that has on a married couple. The decision to be self-sufficient by remaining employed if you are a caregiver, And taking care of your health is important so that you may not need as much care later in life. This is no different than the financial decision you make to save money and use your income differently. Also in this podcast transcript is a link to a 2021 poverty report among the population age 65 and older. It's important to think about this. For example, people age 80 and older have a poverty rate of 11.1%, with women representing 13.6% of this number. So, what is the poverty rate? A link in the transcript will have this information. However, for one person in 2021 living in the Washington, D.C. area, the rate was $12,880. For two people, $17,420. On a monthly basis, this would be $1,073 and $1,451. If we look at this in comparison to average Social Security wages, an AARP article called How Much Will I Get from Social Security estimates that in 2022, the average Social Security retirement benefit is $1,657 per month. Now, that depends on the number of years that you worked, your annual income, and your contributions. So let's say that you're a woman who's been out of the workforce most of your life. Your Social Security payment could be half of that. So instead of $1,657, it could be $800. That would place you in the range of poverty. This is why giving great thought to education that supports career advancement is important for everyone, especially women. It's also why remaining in the workforce as much as possible is important for women who want to be financially independent. As many of you know, I talk to a lot of women who struggle when they become caregivers and can't work, and also other women who rely on a husband's income when caring for a sick husband. Regardless of your situation, if you are not working and you are a caregiver, it's a challenging place to find yourself because you are trying to think of how can I return to work while still caring for this person, and that can be a path where you have to plan. So if we return to looking at solutions, talk about caregiving in your family at all ages. Know what Medicare pays for and doesn't pay for when you're older. Make plans today to save for your retirement. Talk to a financial planner. Talk to an insurance agent. Ask your parents what plan they have for when they need care if they're still healthy. Ask how much money they've saved. If you are going to be out of the workforce to be a caregiver, create a plan to re-enter the workforce and what this might take. If you're out for 6 months, that may be nothing. You may be able to return back to your job. But what if you're out for a year or 2 years or 5 years or 10 years? What will you need to get back into the workforce? Will you need to go back to school to learn new skills? If so, how will you pay for that education? If we're going to look at reducing the number of women and really all caregivers who live in or near the poverty level in older age, we have to start thinking and talking about caregiving and health when we are young. As many of you know, waiting until years down the road results in fewer years to plan ahead and fewer options. Up after this break, Dr. Katherine Ornstein talks about older adults with no family who need care. Pay it forward to help others dealing with health, aging, or caregiving issues by sharing information about this show and my website, PamelaDWilson.com. The Caring Generation is available worldwide on your favorite podcast and music apps: Apple, Google, iHeartRadio, JioSaavn, Spreaker, Amazon Music, Breaker, Deezer, Listen Notes, Pandora, Player FM, Pocket Cast, Podcast Addict, Podchaser, Stitcher, Spotify, TuneIn, and Verbal. You don't have to go it alone. Caregiving doesn't have to be a do-it-yourself job. Visit my website to schedule a one-to-one telephone or video consultation with me. Click on How I Help, then Family Caregivers, and then Eldercare Consultation. This is Pamela D Wilson on the Caring Generation. Stay with me. I'll be right back. This is Pamela D Wilson, caregiving expert, author, and speaker on the caring generation. Thank you for being here, following, and communicating with me on social media, Facebook, Twitter, Instagram, LinkedIn, and on my YouTube channel, where you'll find hundreds of videos. The questions you ask allow me to create videos and the Caring Generation podcast for you. Visit my website and follow the show on your favorite music or podcast apps. You can listen to over 100 episodes. I'd like you to meet Dr. Katherine Ornstein. Dr. Ornstein, thank you so much for joining me.
Thank you for having me.
So your research study was about caregiving needs at the end of life, and it explicitly addressed older adults who are kinless. How was kinless defined for your research, and what percentage of people in the United States or elsewhere are kinless?
Great question to start with, and that's because kinless is actually a tricky term. It's not one that I love. What it means is that individuals who are lacking traditional family relationships. In gerontology, we use this term and others like it, sort of unbefriended or elder orphans sometimes, really to try to get at individuals who are aging without family available to help. So the reason we look at this population is because family is so integrally involved in caring. And the population of kinless are growing. So in this study, we specifically use the term kinless. We define it specifically as those who have no spouse or partner or any children. And that's because those are the most common family members. According to our study, we found that at the end of life, more than 7% of older adults in America were kinless.
Can you talk about the background of the people who participated in the study? So, for example, where they lived, were they male or female, et cetera?
Mm-hmm. Yeah, so this was actually a nationally representative sample from the US. So it samples individuals who are adults over 50 throughout the US. And we're looking at all deaths that occurred between 2002 and 2015. So it's really looking at throughout the US, what is the experience of individuals who die relative to their family. And, unsurprisingly, the kinless differed from those with kin with respect to gender, race, finances, Medicaid, and living arrangements. So, for example, we found that women tended to experience kinlessness at higher rates than men, more like 8%. And again, not surprisingly, the majority of women, when they died, did not have a spouse, right? So almost 3/4 of women did not have a spouse or partner when they died, whereas for men, only 41.9% of men did not have a spouse. And again, we also saw differences related to race. The kinless are more likely to be from racial and ethnic minority groups. They were poor. They're also more likely to live alone and to live in nursing homes.
Do you think, and this is like a separate question, but is the higher population of women who are older and kinless, does that just kind of relate to the fact that women tend to live longer than men?
Yeah, there's many demographic patterns that are factoring in. It's also because we tend to see women marrying older men as well, in addition to women outliving men, and men more likely to remarry after losing a spouse or divorcing. So all of that factors in. Now, we also do see that women are more likely to have children when they die than men are.
Talk about the commonalities you found in the kinless group specific to health conditions like maybe dementia and their ability to participate in daily activities.
So what was really interesting is what we found is the kinless in some way were healthier. They had fewer just numbers, if you just counted the number of comorbidities that individuals had, they were less. They also we didn't actually find differences in self-reported health, which is actually a very important marker of people's health. Just if they say it's poor or otherwise, we did not see differences relative to dementia status or limitations in function relative to activities of daily living.
Was there any indicator about why they were healthier? To me, that sounds kind of contradictory, I guess.
Yeah, right. Well, I think it speaks to a lot of things. In some ways, there's potentially a survivor bias, you would imagine, of the people that might survive, right, to to age. They therefore are stronger and healthier, that they have not died despite not having family. So that's potentially part of it. But I think it also gets at the problem with our looking at kinless, the traditionally kinless, right? Because that's really suggesting that only spouses and children are caregivers. And while spouses and children do the majority of caregiving, they don't do all of it. So we really need to think about other family as well as other friends, other, really looking at non-traditional kin and sort of seeing how those social networks are expanded. And not surprisingly, we actually did see that the kinless seem to be more social. So suggesting that they may not have children or be married, but they have other social resources. So I think that really speaks to an important lesson of this study is maybe we shouldn't just be measuring kin as spouses and children.
Well, and that's a great point because people who would live without spouses and children would have to kind of, in a sense, be more independent, do more, be more social. So that does make sense. So let's kind of talk about end of life care and hospice, which is becoming more common for people. Were there differences in hospice enrollment and the place of death for kinless adults and versus people who had family that were on hospice?
So we actually did not find a difference in hospice enrollment, and we thought there would be. We really thought that individuals who had family would really benefit and would be more likely to have hospice, but we did not find these differences. However, we did find that those, again, traditionally kinless were twice as likely to die in nursing homes. Even when we looked at people who had not been living in a nursing home for, a year before their death. And there was also a tendency for the kinless to be more likely to die in a hospital setting versus their home. And then importantly, we find that kinless seem to be receiving fewer total hours of care. So they're getting less caregiving, either family, unpaid, or even paid caregiving.
Now, there's a lot of solo agers today. Are there any demographic shifts or trends that indicate that kinlessness will increase in the future?
I think that seems to be the suggestion. And importantly, this isn't just a US issue. This is really something that we've been thinking about globally. Other researchers have estimated rates of kinlessness to be higher than the US, more like 11% in Canada, Ireland, and kinless rates are projected to increase. And it makes sense relative to changing family structures. So different, preferences about family formations. We see people having not having children, not being partnered. We also see declining rates of marriage and fertility, as well as increasing divorce among older adults. So the divorce rate has actually been declining in the US since the 80s, but for older adults, it's actually been increasing. And we also seeing increases in childlessness in the US. So as demographers have estimated that there will be more of traditionally kinless older adults in the US. And so I think that's really an important point. It's not just what's happening now, but in 20 to 30 years, what will this mean for, end of life care and hospice care and our support systems?
There was a sentence in your research article, and it said many patients and families may have wanted and indeed benefited from in hospital deaths. Can you explain that?
Yes. So, we focused on where people died as an outcome. And that's because in the US and as well as in um, everywhere, people say that they want to die at home. That's what people suggest. And it's still not, you know, the majority of the case. And hospitals deaths are considered more treatment intense, and so we often think of that as not high quality, but I think that's not necessarily true. While most people say they don't want a hospital death, that does not necessarily mean that it's not appropriate or beneficial for the patient. It also does not mean, we don't know in this study what a patient wanted. So their preference may have been to have a hospital death. It may have been the family's preference as well. So we're sort of making some assumptions here about what people want. And I think it's just an important thing to think about relative to, considering who wants, hospice, who wants to die at home, who wants to be or not be in a nursing home. There are differences and preferences for care.
And so the term in hospital death, could that mean like in hospice, in a hospice like facility death, or is it just hospitals only, period?
We look at hospice as sort of admission to hospice, whether it's in a hospice facility or in the person's home. So most hospice is within the home,
Okay.
essentially.
Thanks for
So
clarifying that.
yes, sure.
You were talking about, 20, 30 years from now, what is all this going to look like? So, separate of the healthcare policies and the healthcare system, what can people do today, especially if they are kinless, to become more knowledgeable and prepared for the care that they might need at the end of life?
Yeah, it's a really important point. And I think, yes, there is a lot that the, policy and healthcare systems can do, but I think we really as individuals have to try to, advocate for ourselves and really think ahead. I think discussing preferences for care earlier with families, loved ones, and friends is really important in really thinking about that, engaging early, talking to friends and caregivers about what we want to do and what we do not want to do is helpful, and making arrangements earlier important. We do need to recognize that, wishes can change over time, but really thinking things through. And, part of thinking things through for those who can is thinking through financially what will happen, what the needs are, what we want. And I think this is true for those who have, children and those and spouses and those who don't, right? We really need to think about it, because just because somebody has 3 children doesn't mean any of them live close by, any of them want to or are able to be caregivers necessarily. So I think it's really for everyone to think of. But I do think in general, earlier engagement, in hospice is likely beneficial for all, to sort of get the support systems in place that people need, as well as more upstream, earlier palliative care.
Is there anything else that you'd like to share from your research that I haven't asked you about?
Yeah, I mean, I think really the bottom line from my research is that, we have to really think about providing high quality end of life care, regardless of what family individuals have. We really need to think about it. It can't just be that you're lucky enough to have several daughters who are readily available to support you. We really need to think about it. But I do want to point out that, there is this concern about the kinless as very vulnerable. And I think we really need to think that through a little bit more. These findings at least suggest they may be more socially engaged, I think terms, really negative terms like elder orphans are not helpful to anyone. I think we really need to think about what people want and to really start looking into sort of the non-kin or like non-traditional social networks and how that can support older adults, so that people have those around them that they want that can benefit them, especially at the end of life.
Thank you so much for your time. I really appreciate it.
Thank you.
Thanks again to Dr. Katherine Ornstein for joining us. If you want to share your story or have a request for a podcast topic, video, or article, visit my website, PamelaDWilson.com, and go to the Contact Me drop-down in the top navigation bar. Then click on and complete the caregiver survey. Thank you all for being here and for your dedication that you show to your loved one's care, and more importantly, the ability to learn to take care of yourself through the education and research offered on this program. Please share the Caring Generation podcast and my website with everyone you know who is interested in proven, reliable tips, information, resources, and research about caregiving, aging, health, and everything in between. This is Pamela D Wilson, caregiving expert, advocate, and speaker. I look forward to being with you again soon. God bless you all. Love to everyone. Sleep well tonight. Have a fabulous day tomorrow and a great week until we are here together again.
Tune in each week for The Caring Generation with host Pamela D. Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D. Wilson's The Caring Generation.